Welcome. I'm Andrea Clessy for Woman's Hospital. Genetics is a growing medical field. Dr. Duane Superneau explains how genetics and medicine work together.
Whenever we consider an individual may have a potential risk to inherit a gene that can cause cancer, we look for certain indicators within the family and the individual. We're looking at potentially young age of onset of the cancer, that is typically the onset of cancer before age 50. Multiple cases running in a family, more than one generation affected. Unusual aspects of cancer, for example, the cancer occurs in paired organs, one breast then the other breast, one ovary then the other ovary, one kidney then the other kidney. That would be a bit unusual. Or looking for other unusual aspects such as a man with breast cancer. While breast cancer can occur in a man, it's far less likely in a man than in a woman. So these may be indicators that there could be a potential genetic basis, that is, there's a gene in the cells that's causing the tissue to go bad to cause the cancer. If these indicators exist, we then consider whether or not the individual is a candidate for genetic testing. So we look for indicators, young age of onset, multiple cases, more than one generation, unusual aspects, or the occurrence of related cancers, breast and ovary cancer, caused often by the same gene, colon and uterine cancer, caused often by the same gene. So we look at these things and take into account what's going on, hope to test an affected individual first in order to identify whether there is or is not a genetic basis to the cancer. A commonly tested gene would be cystic fibrosis, actually, because women who are pregnant or contemplating pregnancy can be screened to see whether or not they are carriers for the mutation. Now, in this case, they're not looking at the gene comprehensively. They're looking at a number of very common mutations that will account for over 95% of all cases. And to go letter by letter of the entire gene to determine whether there's any particular defect would be quite expensive. But to quickly screen for a number of common mutations for any gene is much less expensive, rather easy, and of course if you're picking up the majority of cases, then that's a quick and easy way to determine whether an individual may carry a mutation for a particular disease process. I think that the genetic testing often comes down to who knows what about a particular process and when do they learn it. Although the genes for colon cancer exist, there are not enough individuals getting screened, particularly for the possibility that they themselves have cancer. Perhaps they not letting their physician know about their family history sufficiently to be able to be referred for genetic testing. But individuals who go for a particular battery of tests, for example, women who go almost yearly for mammograms, are going to more likely encounter the possibility that someone can say, hey, you ought to go for genetic testing. So while the certain cancers may be equally prevalent, there's one that's going to be more likely tested than another simply because of the process of screening and who's receiving the medical care to detect that process. Breast cancer is one that's going to be screened for more at the present time because more women are going for regular testing as opposed to individuals who are going for colon cancer screening and coming to the same attention for the possibility of genetic testing. As a word to individuals, it's best to know their family history, to take their concerns to their doctors, ask them about what the problems might possibly be within the family and could they be at risk. They can then get a more expert opinion from a medical geneticist if they need to. They can determine whether testing would be appropriate for them. And hopefully we can lay a lot of anxieties to rest that individuals are not at risk for processes, and if they are at risk, we can capture them early enough to put them into a proper surveillance program to maintain their health.
For more information, visit womans.org. Woman's, exceptional care centered on you.